discussing on the pharmacology. So particularly in this video, we'll be mainly discussing upon the pharmacology of the interferons and the pharmacology of the anti-cancer drugs, so particularly in the anti-cancer therapy. So there are various treatment modalities for the treatment of cancer, but out of all the modalities, out of all the chemotherapeutic agents what are used for these treatment of cancer, so interferons, they are also the drug of choice. So in this video we'll be mainly discussing upon the pharmacotherapy, the therapeutic uses, and the most importantly how interferons are useful for the treatment in the treatment of cancer. So actually, what are interferons? So interferons are those substances what are being synthesized in whenever there is a response, whenever there is an infection by any kind of a virus. So a virus infected cell, basically, that is going to be undertaken, the body's immune system is going to counteract it with the help of by producing interferons. And when we look at the types, so basically interferons, they are of three types, and most importantly the interferons can be of the alpha, beta, and the gamma. And on the basis of antigenicity, they can be subdivided into three categories. Firstly, the alpha interferons, the beta interferons, and the gamma interferons. So these alpha, beta, and gamma interferons, they can be broadly, they have different origins there. So when we look at the alpha interferons, so these alpha interferons, they are primarily, they are of the leukocytic origin. Whereas when we look at the beta interferons, so these beta interferons, they are being synthesized by the connective tissue fibroblasts. And when we look at the gamma interferons, so these gamma interferons, they are being synthesized by the T lymphocytes. Now, we should need to have a thorough understanding as to what is the function of these interferons. So these interferons, they are going to work with the immune system to find and attack what kind of the virus infected cells, and that too these interferons, they are also helpful in the fighting of cancer. So when the body's immune system is there and it is infected by a virus, so in such a condition the interferons are going to combat them, and they are going to attack the viruses, and they prevent that the further attack of the virus from the virus attack on the further new cells which are not being infected. So it is going to, these interferons are going to prevent the further spread of the virus into the upcoming cells. So the function of the interferons, it is going to stop the viruses, and once a virus infected cell is there, the cell is going to respond through the production of interferons, and these interferons are going to prevent the further upcoming cells from getting infected. So actually what is happening is that these interferons, they stop the viruses and the cancer cells from growing and spreading, and they prevent other cells from getting infected. So this is the function of interferons, and they are of three types: alpha, beta, and gamma types, depending upon their antigenicity. But in the pharmacotherapy, so when we look at the therapeutic uses as to how they can be useful in the treatment of a certain kind of a cancer, or in any kind of a particularly the AIDS virus, that is the HIV infected individuals. So in certain conditions such as the AIDS related complications what can be seen in the form of Kaposi's sarcoma. So in such treatment methods where a particular cell is being infected by a virus, so these interferons are the drug of choice. And when we look at that, how these interferons are being synthesized, so basically in the modern day times, a lot of pure interferons can be synthesized, and the technique is the RNA, the recombinant DNA technique. So particularly the recombinant DNA technique is making use of in bacteria, and it has made possible that large amount of pure interferons can be produced. So in the present scenario, if a large quantity of interferons are needed for the treatment of certain viral infections as well as in treatment of cancer, so any kind of large amount of interferons are needed, and these interferons can be produced in bacteria by the recombinant DNA technology. It is possible to produce large amount of pure interferons, and including the most two important species, the most two important types, that is the interferon alpha 2A and the interferon alpha 2B. So students and viewers, do remember that the interferons, they can be produced by the recombinant DNA technology in the bacterial cell, and they are including the two species. Firstly, that is the interferon alpha 2A and interferon alpha 2B. Now, when we understand that as to where these interferon alpha 2A and interferon alpha 2B are going to act, so what is happening is the interferon alpha 2A is used in the management of hairy cell leukemia. So in the management of hairy cell leukemia, these interferon alpha 2A is being used. Apart from this, they are useful in treating the certain neoplastic diseases, such as in the conditions of chronic myeloid leukemia and the AIDS-related Kaposi sarcoma. So this is the use of interferon alpha 2A, whereas in the case of interferon alpha 2B, this is also used as a treatment modality in certain kind of blood cancers, such as hairy cell leukoplegia, the follicular lymphomas, the malignant melanoma, and most importantly, the hepatitis B and C viral infections. So in the conditions of hepatitis B and C virus infections, so this interferon alpha 2B is being used as a treatment method. Apart from this, in AIDS-related Kaposi sarcoma, these interferons are the drug of choice. Now, when we look at the mechanism of actions, so do remember, as I've already said, that an interferon is produced by a cell what is being infected by a virus. Now, this interferon is secreted from the producing cells, and they are going to interact with the surface receptor of the other cells. So, if this is a virus infected cell, and if this particular cell is going to secrete some quantities of interferons, so now these interferons are going to act on certain places in the upcoming cells, in the another cells, on certain target receptors, and there are receptors present for these interferons. So these are the receptors what I am drawing. So these are the receptors, and these interferons, they are going to be secreted from the producing cells, and they are going to interact with the surface receptors. So these are the surface receptors what I've been drawing. All right. So these surface receptors, they are going to interact with the surface receptors and exert their effects. And how are they going to exert their effect? So particularly the interferon alpha and beta interferon, they compete with each other and exert their influence at the same receptor or in the close proximity. So this green dot what I have drawn, it is the, for example, the interferon alpha, and the blue dot what I have drawn, it is the interferon beta. So they are going to compete for the same receptor. They will be competing for it, and they are going to exert their influence, exert their effect by competing for the receptor site where they are going to act. So more or less they occupy the same receptor, or they lie in the close proximity to the receptor. Whereas the interferon alpha bind at different receptors. So if a particular interferon alpha is there, so it is going to bind at different receptors, and as a result what is going to happen is that these series of complete complex intracellular reactions are going to take place, and these intracellular reactions can be in the form of synthesis of certain enzymes, in the suppression of cell proliferation. Apart from this, there can be activation of the macrophages, and there is increased cytotoxicity of the lymphocytes. So this is the mechanism as to once the interferons, they are going to bind at the receptor site intracellularly, what they are going to do is they are going to alter the functioning by synthesis of certain enzymes. They are going to suppress the cell proliferation, and they are going to even activate the macrophages, and there is increased cytotoxicity of the lymphocyte. So actually this exact mechanism by which this cytotoxic effect of these interferons is there, it's still not clearly understood, but this is a method, this is the mechanism of action, how interferon drugs are acting. Now, once we look at the pharmacokinetics, so it is very, very important that these interferons, they are given in the treatment of cancers and in treatment of certain viral infections such as hepatitis A virus, hepatitis B and C virus most importantly. particularly hepatitis B and hepatitis C virus in HIV virus, as well as in certain kinds of blood cancers. These interferons, they form the drug of choice. And in the pharmacokinetics, when we look at, so these interferons are being administered to the patient through intramuscular or the subcutaneous injections are available, and these intramuscular and subcutaneous injections are given to the patient. And when we look at the interferon alpha 2b, so this is given through the intravenous route. It is the intravenous form of this interferon alpha 2b is available. And the interferons, when we look at the pharmacokinetics, so we look at the how the kidneys are responding to it. So when we look at that these interferons, they are going to have undergo the glomerular filtration and are degraded during the renal during reabsorption, but the liver metabolism is minimal. So students and viewers, this is a very short discussion where I have discussed about the interferons, the pharmacology of interferons, and how they are used in the treatment of cancers and the treatment of viral infections. So if you still have any queries or comments, you are most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If you like this video, give this video a thumbs up and don't forget to share amongst your friends. Thank you for watching.